Oh, there I am. Sorry, I didn't have the video going. Sorry about the fan in the background. It's a little loud in here. I'll try to speak loudly so everybody can hear me well. And again, I want to welcome everybody to today's live webinar. I'm Dr. Marc Adelsheimer, speaking to you from Regenexx Pittsburgh. And we're going to go ahead and get started. Talk about some exciting things we're doing here in our practice. So I'm going to share my screen with everybody, which we can go through my slide presentation. Okay, so the title of today's talk is how we can avoid surgery by reducing pain and using various regenerative treatments that we have to offer you here at Regenexx Pittsburgh. Again, I'm Dr. Marc Adelsheimer, coming to you live here in our office at Regenexx, and I want to thank everybody for sharing part of their afternoon with me today. And if there's any questions, I'll be happy to answer these at the end. So again, to introduce myself, I'm Dr. Marc Adelsheimer. I graduated from Duke University. I then graduated from medical school from the Medical College of Pennsylvania. I did my residency in physical medicine and rehabilitation at Tufts University in Boston. And I moved to Pittsburgh in 1996, where I joined Dr. Paul Lieber in practice, and we've been in practice ever since. In my spare time, I play some golf. To talk about our practice, we are now Regenexx Pittsburgh. As I mentioned, I have Dr. Lieber as my partner for over 20 years, and Dr. Jesse Sally joined us a little over 5 years ago. We have 5 locations in the Pittsburgh area. Our main location is in RIDC Park in Fox Chapel, but we also see patients in our 4 other satellite locations, which are in Monroeville, Sewickley, Washington, PA, and Bridgeville, PA. We're part of the Interventional Orthopedics Foundation, and our practice has been noted in leading journals, including the Best Doctors of Pittsburgh, for 5 years in a row. So why are we here today? What are we here to just talk about? What can I tell you about our practice, and why are you here? That's a more important question. Why are you here? And the main answer to that is to help, so we can help you to improve your quality of life. So whether that means playing some golf or other recreational activities, whether it's aggressive exercise, including biking, swimming, running, or it's just spending quality time with your grandchildren or children or friends. So again, the purpose of what we do is to help you improve the quality of your life. So what's Regenexx, and why are we Regenexx Pittsburgh? Regenexx is a company based out of Colorado in 2005, where they started doing orthopedic stem cell injections. This was started by Dr. Centeno and Dr. Schultz, who Dr. Lieber and I have both known for close to 20 years now. And they started doing these, and they were the first clinic on earth that started using orthopedic stem cell use in 2005. Since then, they realized that they couldn't treat everybody in Colorado, so they branched out to various areas around the country. And here in Pittsburgh, we were one of their first affiliates. And we've been partnered with Regenexx now we're going on our 9th year. There's 60 different clinics around the country. Every Regenexx provider is a physician, either an MD or a DO, and everybody's trained by Regenexx, meaning that we've all gone out to Colorado and spent multiple times training with Dr. Centeno, Schultz, and his partners in how to do correct interventional orthopedic treatments. And that includes prolotherapy, PRP, and stem cells, which we're going to be talking about in a few minutes. So Regenexx is not a product, but it's really a family of medical procedures that define what we consider a new medical specialty. And that's what I'm going to talk about a little bit first, and that's interventional orthopedics. So it's not an add-on to an existing product, but it's a new way of approaching orthopedic problems. So what is interventional orthopedics? Well, it's orthopedics done without surgery, and that's what we're talking about. So interventional means with a needle. It's a less invasive way to avoid more invasive surgeries. So we're treating the same conditions that an orthopedic surgeon would treat, but without surgery. We do this by helping the body to heal itself. Rather than cutting things out, which is what surgeons do, let's let the body heal itself. And we're going to help you to facilitate doing that. So looking at orthopedics, it's very clear that surgical orthopedics will not be the dominant form of orthopedic care going into the 21st century. There's been a lot of studies recently on meniscal surgeries, and 95% of the meniscus surgeries that are performed are not needed. There's been a lot of research, especially in the last 5 years, that's showing that removing this tissue not only isn't necessary, but it actually causes harm. It speeds up the onset of arthritis. So rather than cutting stuff out, let's start injecting biological agents so we can try to help heal things in a quicker fashion. So this is a little timeline of where orthopedics has been. In 2000, almost everything was done with surgery. By 2015, injections had bridged some of this gap. Here we are in 2021, and we're on path to this, but by 2030, approximately 70% of what was treated in 2000 with orthopedic surgery will be replaced by interventional injection procedures. So this is already happening, and will continue to happen with the knowledge and outcomes that Regenexx is providing. So interventional orthopedics is not something that's easy to learn, not something that you can get on a weekend course, and not something that most physicians do. So most physicians are trained in doing simple injections, sticking a needle in a knee, a shoulder, a hip, maybe in a hip if they're lucky if they can get the right spot. Interventional orthopedics, however, is significantly more sophisticated. We use musculoskeletal ultrasound and fluoroscopy to guide our needles into many different locations. So what I just am showing on the screen now are when we're looking at a knee, a hip, or a shoulder, we're not just looking to stick the needle in the joint. For instance, the knee that I just showed, we're looking to hit all of these different structures, the ACL, the PCL, the meniscus, the quadricep tendon, the pes anserine bursa, the hamstring tendon, the patellofemoral joint. So again, not just aiming for one structure. And this takes a lot of time and expertise. We have been doing this in our practice, as I mentioned, for over 9 years now. And seeing a physician that has expertise in this area will lead to significantly better outcomes. So what are we injecting? We're injecting biologics. Biologics are your cells. Again, emphasizing things that come from you, autologous. These are not taken from other sources, meaning from somebody else. Biologics are PRP and stem cells, and we're going to be talking about those in a few minutes and the differences between PRP and stem cells and why we use the different biologics for different problems. But who is biologics for? Again, biologics can be for anybody who, whether you're a weekend warrior, a professional athlete, or just someone who wants to help improve the quality of their life by playing sports or just being more active. So again, it's all about improving quality of life. And that's what we're striving for here at Regenexx. So I'm going to talk a little bit about the different treatment types that we do, and then talk about the indications for each of these, spending a little bit more time talking about our same-day stem cell protocol. But before we get into that, we're first going to talk about prolotherapy, which is something that we use as part of our stem cell treatment. Prolotherapy is actually an old treatment that's been around for 50 years and is the grandfather of regenerative medicine. So this came about first before PRP and stem cells. It's a treatment that uses dextrose, and when you inject it into a certain area, it starts an inflammatory response, which leads to healing. We don't use a lot of traditional prolotherapy as a standalone treatment. However, we do use it when we're doing our stem cell procedures or with other treatments. So again, it's important to know that prolotherapy is where everything started, but PRP and stem cells have kind of replaced a lot of the traditional prolotherapy treatment that we were doing in the past. And again, Dr. Lieber and I have been doing prolotherapy for over 20 years. So moving on to the regenerative treatments, meaning use your own cells, there's basically two different cells that we use. One is the platelet or blood platelet treatments. And here at Regenexx, we call that super concentrated platelets. Other places known it as platelet-rich plasma or PRP. PRP has become very popular, especially in the sports medicine community, because it works really well to treat sports-related injuries, especially tendon problems like golfer's elbow or tennis elbow. That's lateral epicondylitis or medial epicondylitis, rotator cuff tendonitis, medial meniscal tears in the knee, Achilles tendonitis. All of these things that end in itis respond really well to PRP or super concentrated platelets. So what's involved with a SCP or PRP treatment is using your own platelets. What will happen is you'll come to our office and we'll draw some blood from you. We take your blood to our laboratory. Our lab technician will spin your blood down and isolate the pure platelets. And then we will use these platelets to treat whatever condition we are evaluating for. And again, this can be a wide different range of conditions, anything from tendon, ligament injuries to spine pain to mild and moderate arthritis. A PRP treatment is all done on one day. So it's a little less involved than a stem cell procedure. It's important to know that a lot of, in fact, almost all orthopedic practices now offer PRP, but they are offering an inferior product. Here at Regenexx, we are able, due to our processing and our laboratory equipment, to make the best PRP product available on the market. And this is an example of our Regenexx PRP, or what we call SCP on the right, and standard PRP on the left, which you will get at your orthopedic surgeon's office because it's done with an inferior product with a bedside machine. You can tell it's inferior because it's still red and bloody, meaning that they were not able to separate all of the red blood cells out. There's no reason to be injecting red blood cells because if you do inject the red blood cells, it only causes more pain and does not lead to any healing. So in addition to our product being able to separate out all of the red cells, we're also able to concentrate those platelets to a significantly higher concentration, which means that you will have a better product, which will lead to a better healing response. We also use blood platelets when we're treating nerves. So we use that same platelet, but we take it to the laboratory. We treat that, which causes them to lyse. When they lyse, they release all of their healing enzymes, and this works great for nerve problems. One of the main areas that we treat for nerves are the spine. So instead of doing epidural steroid injections, we do epidural platelet lysate injections because they lead to long-term improvement. And I have a slide or two on that in the future that we'll take a look at. We also use platelet lysate when we're treating other nerve entrapments like carpal tunnel syndrome. So if you have an entrapment of the median nerve here at the wrist, under ultrasound, we can isolate that entrapment, get a needle down there, put platelet lysate in, and it will help to cure your carpal tunnel syndrome. A very good, safe, and effective procedure that does not require surgery. This is what I had mentioned in comparing epidural steroid injections to epidural platelet lysate injections. And I know this firsthand because I've done thousands and thousands of epidural steroid injections in the past, but we have replaced almost all of our epidural steroid injections with epidural platelet injections for this reason. Because an epidural steroid injection after 3 months is pretty much gone. Any effect, any benefit that you have is gone. Whereas the platelet injections can lead to long-lasting, in some cases even permanent improvement in people's conditions. And obviously that's what people want. Nobody wants to come in and keep getting repeat injections every couple of months. In addition to not wanting to get the injections, multiple steroid injections are unsafe and can lead to long-term problems. So if anybody out there is getting steroid injections on a regular basis, whether it's in the spine or somewhere else in your body, be careful because these can definitely cause problems, especially in women. They can lead to osteoporosis. They can lead to adrenal insufficiency in both men and women. There are a lot of different complications with long-term steroid use. Next, I'm going to talk about our bone marrow concentrate stem cell procedure. This is using your own concentrated cells to help heal your body. We extract high volume from the iliac crest, which is bone marrow concentrate, and it's used for more advanced conditions. So the bone marrow concentrate is where the stem cell lies. I'm going to go through what's involved with a bone marrow concentrate stem cell procedure in a minute. But we use these cells to treat more advanced problems, more severe problems like severe arthritis or a rotator cuff tear as opposed to a rotator cuff strain or just tendon problem, a ACL tear as opposed to an ACL strain. So when you're dealing with a more advanced problem, the stem cell procedure is basically what you're looking at. And again, this is from bone marrow concentrate. These are your own cells. And this is basically a slide to help describe what's involved with doing one of these procedures. So before we get into the actual procedure, what would happen is you would make an appointment to see me, to see Dr. Lieber or Dr. Sally in one of our 5 locations. We would do a comprehensive history and physical examination and talk to you about what options we're recommending. If we're recommending a bone marrow concentrate stem cell procedure, we would go over that with you. We talk about the pluses and minuses, the expectations, and most importantly, we will give you a very honest opinion as to whether or not we think this will help you. If you decide, yes, I want to go ahead and proceed with it, this is actually a 3-step process. So this procedure using bone marrow concentrate to get your stem cells is a 3-step process. The analogy of these 3 steps is like planting seeds in your garden. So the first step is done with prolotherapy, which again, the grandfather of regenerative medicine. So you'll come to our office and under ultrasound guidance, one of us will place prolotherapy solution into the joint that we're treating. And it takes about 15 minutes to do, and then you leave. We don't need to get any blood or bone marrow from you on that day because prolotherapy solution is something we have on our shelf. So what the prolotherapy does to the joint is it tills the soil. It makes it ripe and rich. So when we put the stem cells in a few days later, they do better. So the prolotherapy will bring a lot of blood flow to the surfaces, which again which is essentially tilling the soil before you plant your seeds. Appointment number 2 is a bigger day because that's 2 parts. As I mentioned, the stem cells from you that we use are bone marrow concentrate. But the bone we utilize is what is demonstrated in this picture. It's your pelvic bone. It's in your lower back. It's right back here. It's not your hip. It's not your spine. It's the largest bone in your body. It's very easy to get a needle onto that bone and very easy to get a needle into the bone. Mind you that this injection, like every injection we do in our practice, is done under guidance with either X-ray or ultrasound. So we will never be sticking a needle in you blindly and hoping we hit the right location. Every injection is done guided and done into the appropriate area. This is a part of the procedure that a lot of people will get a little squeamish about because it sounds a little scary to get a needle stuck into their bone. That being said, we have done several thousand of these here in our clinic, and it is really a very safe and very well tolerated procedure. We do have some options for anesthesia for people that are nervous about it, but the truth is most of our patients do fine just with local anesthesia. It is really a safe and easy procedure to do. Once we get your bone marrow, we take it to our lab. My lab technician then has to process the bone marrow. It takes them about an hour and a half to 2 hours to do that, during which time you leave and go get some breakfast or lunch, depending on what time of day you're here. But we need you back the same day to put the stem cells that we've isolated from your bone marrow into the correct location. The reason we need to do it the same day is because they're alive and we want to put those live stem cells right back into your knee, for instance, right then. So that day is a bigger day, but a lot of that time is downtime where you're going out and getting something to eat and just kind of waiting for the lab to process the bone marrow concentrate to isolate the stem cells. After we place the stem cells in the correct location, again, using our interventional orthopedic skills, meaning ultrasound and x-ray, we will map this out by looking at your MRI or your x-ray beforehand and knowing exactly the locations that we want to place these cells so they're in the correct spot. That's day 2. And then you come back a couple of days later, usually 2 days later, for your third injection. The third injection is done with PRP, or platelet-rich plasma, your platelets. Why? Because platelets, in addition to being a healing agent on their own, also work to make stem cells work better. So they basically fertilize the stem cells or jumpstart them, give them an espresso shot, make them work that much better. So the analogy of the 3 steps is tilling the soil, planting the seeds, fertilizing the seeds. So that's what's involved with a bone marrow concentrate stem cell procedure, generally done over the course of a week. One thing to keep in mind, this is not a quick fix. Just like when you plant seeds in your garden, you don't have flowers the next day. Things take time. It's going to take about a month before you start feeling better, and about 3 months before you're like, wow, this is a lot better. Wow, I am so happy I did this. And really up to 6 months before things peak. That being said, you're right back to your baseline where you were right after the third step of the procedure. So you may have a little bit of increased pain the night of the stem cell procedure. We'll give you some pain medication for that if you need it. But by the time you've had your third injection, you're right back to where you were for baseline, which is really important when you're comparing that to surgery, because if you're having surgery, it can take you several months to get back to your baseline. If you work and you're looking at worrying about taking time off of work, after the third appointment, you can go right back to work. There is no reason not to. So first and foremost, is it safe? Yes, this is a very safe procedure. I think this is always the first thing to talk about, because when you're comparing it to surgery, it's a significant difference. We have never had any incidents of death, heart attack, stroke, infection, nerve damage, blood clots, cancer, or other problems that surgery can have. Again, everything we do is guided under ultrasound or x-ray. So when you're comparing our clinic to other clinics who do, quote, stem cell procedures or other similar type procedures, they don't know what they're doing and they're not doing it guided. So it may not be safe. Regenexx is also published on safety data, and the data shows how safe our procedure is. So I'm going to talk briefly about some of the main areas in the body that we treat with our treatments, beginning with the knee. The reason why I'm beginning with the knee is it's the most common joint that we do treat with stem cells because it works the best. So, and the number 1 condition we treat with stem cells in the knee is osteoarthritis. The reason being is, number 1, it's the most common joint to develop arthritis, but number 2 is even if you have end stage, bone on bone, I need a knee replacement arthritis, you can undergo a bone marrow concentrate stem cell procedure and expect to get about a 67% improvement, which is significant. We've also looked at age and obesity, and neither one of these are a factor. In fact, we've done a 98-year-old gentleman in our practice, and we've done several morbidly obese patients that have gone on to have excellent outcomes. So knees are a home run when it comes to regenerative treatment. We also treat meniscal tears and ACL tears. ACL tears are more for the young athletic population. And this is a really exciting area that we're able to cure with the bone marrow concentrate stem cell procedure. In fact, I have an MRI of that coming up in a minute. But before I go to that MRI, this is just a typical patient that was in our practice. This is Pam. She's a 58-year-old aerobic instructor who had 4 years of severe knee pain due to osteoarthritis, grade 4 chondral lesion. Grade 4 is the worst you can get. Her pain was a 6 or 8 out of 10. She was not able to work because the pain was so severe. She received a same-day bone marrow concentrate stem cell procedure with our practice. And within 3 months, she had gone back to teaching aerobics. She felt 90% better, and her pain had basically gone away. Again, very typical case study of someone that you'll see with osteoarthritis in our practice. This next slide is a picture of an ACL, both pre and post. I know everybody isn't a radiologist, but this is what a torn ACL looks like, where I'm pointing to with my arrow. And this is what a healed ACL looks like. I think everybody can appreciate the difference between the dark black line that you now see here that you don't see with the pre-image. The next joint that we most commonly treat is the shoulder. And for shoulder, rotator cuff tears, as long as they are not full thickness, separated tears greater than 1.5 centimeters, we can treat these with same day bone marrow concentrate stem cell procedures and get significant improvement. So rotator cuff surgery is often major, and we can avoid surgery for folks with our regenerative treatments, whether it be bone marrow concentrate, stem cell procedure, or possibly just a PRP procedure for a less involved problem. We also treat labral tears, which is a deep ring of cartilage that is often only treated surgically in the past. You can treat this with either a bone marrow concentrate stem cell procedure or with a PRP procedure and expect a significant improvement. These are also known as slap lesions. And more common conditions like tendonitis and arthritis can also be treated in the shoulder as well. This is an MRI example of someone with a torn rotator cuff, both pre and post stem cell procedure. You can see the significant improvement in the post stem cell procedure. Here you don't see the rotator cuff tendon, it's been torn. Here it's reattached. Moving on to the hip. The hip is a tougher joint to treat. However, the right hip candidate is a good candidate, meaning that if the hip is end-stage osteoarthritic, unlike the knee, it may not be as good of a candidate. But if it's not end-stage and you're a little younger, hips do very well. So if you do have a hip problem, I still highly recommend coming in and getting an evaluation with myself, Dr. Lieber, or Dr. Sally. The outcome still can be very good. However, if it is end-stage bone on bone and there's nothing that we can do about it, we will let you know. There's also a condition known as avascular necrosis, where part of the hip joint dies. And we can treat that by sticking a needle down into that bone and placing stem cells directly into the bone. Hip outcomes can be very favorable, again, for the right patient. This is an example of a needle going all the way down into the bone where we place stem cells directly into the bone for somebody who was suffering from avascular necrosis. So the last area I wanted to talk about was the spine, which is one of the main areas that we treat. We treat all of these conditions, whether it be sciatica from an irritated or herniated disc. We treat facet joint pain, ligamentous pain, spinal stenosis, sacroiliac problems, post-surgical problems. Spine treatment has been very effective in our practice. We've been doing spine for years. And again, as I mentioned earlier, we've transitioned most of our patients from traditional steroid injections or other pain treatments to regenerative treatments, primarily with platelets, because of the great outcomes that they have in our spine problems. So how does Regenexx stack up to other, quote, clinics that are doing similar type of procedures? I'm going to talk a little bit about the different types of clinics that are out there and why you should consider us over them and what the difference is. There's a lot of, especially clinics run by chiropractors, that are using amniotic cells or cord blood from a pregnant woman. These cells contain no live stem cells. It's been studied and validated that there is absolutely no live cells that they're putting into you. So again, beware if someone's selling you on a stem cell injection when it's not. It's mostly just baby urine, as opposed to what we're putting in, which are actual adult mesenchymal stem cells. Again, this is consumer fraud. The FDA is looking at this. They are not actually stem cell procedures. These are also usually done in a chiropractor's office and not done by a physician, not done under guidance, meaning they don't have the skills that we do using our ultrasound or musculoskeletal fluoroscopy. Again, not done by a physician, and the cost can be just as much, if not more, than some of the things that we have to offer. There are other clinics that are also using fat as a source of stem cells. First of all, the FDA has been regulating this and has said that it's not FDA approved, whereas bone marrow concentrate is FDA approved. Research shows that bone marrow concentrate is a significantly better location to get stem cells than fat, because there's 10 to 20 times the number of mesenchymal stem cells in bone marrow than there is in fat. So basically, you're getting a better product. Head-to-head research heavily favors bone marrow over fat when it comes to doing stem cell procedures. And we're able to get about 20 times the number of stem cells when compared to a fat stem cell procedure that you might get somewhere else. People also say that, hey, this doesn't work, my stem cells are too old. As I mentioned earlier, that is absolutely not the case. We've done several patients in their 90s. We've done even more in their 80s and 70s. So this is absolutely not true. Your body continues to replenish stem cells during your entire life. So therefore, your stem cells are not your age. Your body's actually made these a couple of months ago. So question about financial part. This is the downside to what about these procedures. Most often insurance does not cover the actual procedure, but they do cover everything else around the procedure, especially your evaluation to see us in the office at first. So again, the consultation, the follow-up, all diagnostic testing, any bracing or therapy that we would order is something that your insurance would cover. So you have nothing to lose by coming in and making an appointment to see us to see whether or not you would be a candidate. So just in conclusion for today's talk, Regenexx isn't magic pixie dust. It's advanced, precise, safe interventional orthopedics. We've been doing this longer than anyone in the United States. We have more treatment options than anyone else. And we have published more than anyone in our online registry. We also use these resources to continuously evolve this. This is an evolving science. It's been great to be on the cutting edge, and this is where the future of medicine lies. So again, very excited to be and privileged to be doing this type of medicine. I have been helping thousands of patients over the past few years, and it's been wonderful. And I highly recommend that you come in for a evaluation so we can tell you whether or not you would be a candidate for one of our treatments. So how do you get started? Basically, call our office and make an appointment. And I would be happy to evaluate you, or Dr. Lieber or Dr. Sally in any of our offices. And we will give you an honest opinion. And I think that's the most important thing that we can promise to you, that we'll let you know whether or not we can help you with your condition and what those treatment options would entail. So I want to thank everybody once again for joining me today. If there are any questions, I'm happy to answer these now, and hope everybody has a great day out there. I'm not seeing any questions. Hold on, something's wrong. How do my stem cells work as a healing agent? Stem cells they're immature cells that have the ability to differentiate into cells that can create new tissue. That's one of the things that they do. The other thing that stem cells can do is a orchestrated healing response. So if you take stem cells and you place them into an area where there is cartilage lacking, they will call on other cells to help heal that damaged cartilage. So that's two things that they do for an area. Number one is they help to regrow new tissue, and number two, they help to heal the current area. So if you check the biochemistry of a joint pre and post stem cell injection, you will go from a toxic environment to a healthy environment. And that's one of the main, and that's basically how they work. How long is the downtime after the procedure? There's really no downtime. By the time you've had the third injection, you can go back to work. You can go back to regular activities. We do recommend that you go to physical therapy. We will give you a prescription for physical therapy, because it's really important that after the procedure, not only will you go to therapy, but it's important that you start to do the right exercise program, because the stem cells or the PRP will work on the joint. You need to kind of work on the muscles, and that will help you with answering, with having the best long-term outcome. Today's webinar is taped. Someone asked if this was taped and I can review it. Yes, it will be available. It should be available on our website. If not, you can contact our office and we can let you know how we can get that available to you. As far as someone else asked, I have bow leg and knee problems with no pain. The problem when your knees start to bow is that they're becoming arthritic, and when they're becoming arthritic, they tend to keep going and get worse and worse. Bowed knees is not a reason why we can't do the procedure, so I would definitely recommend coming in and letting us take a look at it. If they become too severe and end stage, sometimes you wouldn't be a candidate anymore. So my recommendation for someone who has bowed knees is to come in sooner rather than later, because we don't want to let that go too long. As far as the price for a consultation, you can ask that when you call in, and my scheduler will be happy to answer that question for you. All right, well, I want to thank everybody once again for joining me today for the webinar, and it should be recorded again so you can get access to this later. A lot of great discussion here. We do a lot of Facebook Lives. And again, the most important thing is just come in for a consultation, and we will give you an honest opinion. I want to thank everybody for joining me today, and have a great day out there.